This question is from a recent post I did on vaginal estrogen. You want to know why blood clots are listed as a possible side effect if that's not the case, because the black box warning label is scaring you and you haven't started taking it yet. I fear this may not be a short response, but I do want to make sure I'm adequately answering your question. So many years ago, over 2 decades ago, there was a study done on hormone therapy, and that study showed that it could increase the risk of stroke, blood clots, cardiovascular disease, also even some cancers. And so the FDA put a black box warning on all estrogen products, even though the estrogen that was in the hormones that they were studying at that time was a synthetic estrogen prescribed at very high doses in that study. Those warnings never should have been applied to local low-dose vaginal hormones because they are so low dose and they are not absorbed systemically by your body. Also, it is literally biologically impossible for something that you just apply to your body topically, like vaginal estrogen, to cause a blood clot. For something to cause a blood clot, it actually has to be processed by your liver, which means you have to swallow it and it needs to go to your digestive system and be processed by your liver in order for it to cause a blood clot. That's not what you're doing with your vaginal estrogen. So unfortunately, the FDA just slapped that warning on any product that contained estrogen. So that warning label has been on there ever since, but it was never correct, and there is zero data or evidence that suggests that vaginal estrogen does any of the things that are on that black box warning label. It says it could increase your risk of endometrial cancer. That is not true. It says it can increase your risk of dementia. That is not true. It does not increase your risk of stroke or blood clot. So you do not have to take my word for this. If you go to the link in my bio, I have the American Urological Association's clinical practice guidelines on the genital urinary syndrome of menopause. In those guidelines, it states that physicians should counsel their patients that all of those things that I just listed are not correct because they know that black box warning label is on there and they know that it is deterring physicians from prescribing it and it's deterring women from taking it and using it. Vaginal estrogen is extremely safe. Also, recently, a group of menopause experts just met with the FDA to implore them to remove this black box warning label because it's inaccurate and because it's scaring women from using it. If you want to go to the link in my bio, I also have that full recording, that expert panel that met with the FDA. The recording of that discussion is linked in my bio as well, so you can hear it directly from the top leading menopause experts currently right now. The FDA just closed their comments. They were taking public comments from people to say that they want this black box warning label removed because there is a big push for this. They just closed their public comment section, but also, in the link in my bio, I have the Unboxing Menopause link. They are collecting signatures on a petition to send to the FDA to petition for the removal of a black box warning because for exactly this reason, women are being scared away from using a very safe, very effective treatment. Vaginal estrogen treats the genital urinary syndrome of menopause. It helps prevent vaginal atrophy. It decreases your risk of UTI by up to 60%. Do you know how many old ladies die in nursing homes from urosepsis? Vaginal estrogen prevents that. It also helps with dryness. It helps with discomfort with intimacy. It helps with bladder frequency and urgency. And it can also help with bladder incontinence. It really should be a must for every menopausal woman. Please do not be afraid to take it. I promise you it's safe. Go to the link in my bio for those resources so you can learn more about it.